Welcome to Dr. Milton's Social Work Show. I know everybody's talking about the coronavirus, COVID-19, and I think I'll weigh in on this as well. I've been very disturbed by a lot of the things I've been seeing here in the community, on Facebook, on YouTube, on Twitter, at White House press conferences. And I just think we ought to ground ourselves in this moment on two realities. One is we're all connected. There's no such thing as this coronavirus will pass over any group of people, Republicans, Democrats, independents, babies, teenagers, young adults, elderly people. It will affect all of us. We are all in this together, not just in our homes and our communities, our towns, our cities, our states, our country, but in the world. This is a global pandemic. And number two, that we ought to root our responses in best practices in science, not in partisanship, not in religious what is the word? Religious fanaticism. We ought to go with the best practices in science. I mean, sadly, thousands and thousands of lives have been lost to this disease already. In South Korea, in China, in Italy, in other nations around the world. It is quite serious. Other people have been in this disease process for a lot longer than us, because it originated over in the Far East. But we're here now. We're all in the same boat now. We're all connected. We all inhabit this precious earth. We all are at potential risk for getting the disease, and some of us won't fare well when they get it. Most of us, the good news shows, the science shows, will recover from it just fine. And it'd be sort of like having a bad case of the flu, a bad cold, for the overwhelming majority of people. People are in panic mode, and that's what's disturbing to me. On one hand, you've got the people going out and shopping and taking all the paper products off the shelves and hoarding meats and hoarding sanitizers and hoarding masks and other kinds of things that, quite frankly, others need, especially the healthcare workers and especially the people most at risk for this disease and the fatality of this disease, which is not young, healthy people per se. They have a better chance with good immune systems, with no underlying conditions, out of the age bracket that's most concerning. Those folks need it. The healthcare workers and doctors in hospitals need it. What we're trying to do right now is flatten the curve, prevent the peak, the worst case scenarios from happening in our cities, in our towns, in our state, in our country. And people have to see that this is a collective responsibility. I've seen people playing out basketball here in my community. And you can't play basketball doing social distancing. It's not possible. So what are they? They're not taking it seriously? They don't understand that that kind of intimate contact is not recommended right now by the CDC? They don't understand that? They don't believe that? Despite the science, despite the tragedy going on, the horrific tragedy going on in Italy, in Wuhan, China, in South Korea, in New York City, in New Jersey, where we live. They don't believe it. It's disturbing to me. Playing basketball, multi-families congregating and hanging out. I listened to a press conference this morning with the governor of New York, who talked about his total concern about the density of the population of people hanging out in parks. This is not a holiday. This is not spring break. This is not Christmas recess. Schools are shut down. Businesses are shut down. The economy is tanked. I don't know about you. My 5013, excuse me, my 401k, sorry about that. My 401k has tanked. This is serious, an economic calamity of the likes we have never seen. And that was a slip about the 501c3s, because I learned yesterday that the federal bills that were passed to offer relief to people in our economy failed to include nonprofit organizations and their staffs. Imagine that. Organizations, nonprofits, cancer organizations, health organizations, organizations catering to the poor and the marginalized, Alzheimer's and other special interest nonprofits who do raise money, lupus and cancer and Alzheimer's. They're not included in this bill. They have staffs. They have employees. In fact, they're a great part of the economic engine of this country. I know everybody's talking about small businesses, and that's true too. We aren't pitted against one another. I mean, it's obvious when the federal government has the will to shake loose dollars, they can create it on a heartbeat. Look at it, $2 trillion already they've come up with to help mediate the crash and the doom and the gloom we're about to all experience, right? So my point is I'm disturbed by some things I'm seeing. Disturbed by the long lines I see at Walmart and other stores where people aren't practicing social distancing. When you're at the cash register and you're breathing on my neck. This happened to me. I was in Puerto Rico recently and I went shopping and I was in line and some man literally inches from me sneezed on me. I looked at him and he said, "Oh, don't worry about it, miss." Hey, I'm in a wheelchair actually, right? Because I don't have good mobility. I'm in a wheelchair. So your perception is obviously this is a person who may not be 100% well, right? And sneezed right on me. Just sneezed. Didn't say a word. And then I had to check him, you know. I had to check him and say, you know, excuse me, but you sneezed on me. You know, you're supposed to be 6 feet back. And he says, "Don't worry about it, miss. I have allergies." And that's true. I'm wiping my nose now because I also have allergies, so I understand it. But take this seriously. This is nothing to play around with. On the other hand, another thing I find quite disturbing is how people are creating conspiracy theory around this. It's so interesting to me. And it's an interesting phenomenon that's happening because for many, many years, there's been a group of individuals. Steve Bannon comes to mind, some evangelists, some other wacko conspiracy theory people, Alex Jones and others. And not so, and not people that are elite like that. People we don't even know about. People on YouTube and Twitter and Instagram and Facebook peddling false information, peddling lies, breaking our ability to be confident in our government, confident in the science that's coming out, confident in the information that's coming out. There are naysayers who do not believe this is true. This is not going on. That's disturbing to me because this is real, folks. And you know what? MSNBC and others who continually are reporting things about Donald Trump's and the administration's failure to act quickly and things like that, I hear you. You have said this for weeks and weeks and weeks. And you know what? We should call out all inaccurate information. We should call out lies. We should call out things that are not true and accurate. But move on, people. Move on. Let's focus more on getting information to people about the seriousness of this problem. You know, in Fox News, for a long time you were peddling part of the conspiracy, and I think you might have turned a little bit of a corner in embracing this as a serious matter. I hope so, because red states who failed to implement Medicaid expansion under the Affordable Care Act that the 44th President of this United States enacted with Congress, there's no health care. And there's a disproportionate number of people watching your show, Fox News, who are taking information from you where you called this a hoax, where your leadership called this a hoax. And those people are in harm's way. Shame on you. Shame on you. Media has to come together and eliminate the bickering, the partisanship. And this is a national crisis. People need information. People need to know where to go for help. People need to know. So rather than bickering and peddling false information and these narratives that this maybe isn't true, or, you know, whatever, we need to get the media on board with giving good information. So I guess what I would like to do is give you some of that information myself. So I'm on the CDC.gov website. You see it here on the TV. Just go to CDC.gov. These are scientists. These are career professionals. These are people you can trust. And they lay out for you, how do you protect yourself? What do you do if you think you're sick? What are the things you need to know? What do you need to know? Well, what are the symptoms of COVID-19? What are they? Well, this seems to be a list of the symptoms. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease 2019 cases. These symptoms may appear 2 to 14 days after exposure. And again, there are a lot of people who may have this COVID-19 who are not symptomatic. They don't even know they have it. Meanwhile, they're playing basketball with each other, and they're meeting in multifamilies and groups and standing in parks together and lining up in cashier lines on your neck. They could be carrying the illness. Partly why we don't know how many is because we aren't testing enough, and we are ramping up the testing. Yeah. It was botched. Trump waited to get the American test. He didn't trust the tests coming out of Germany and China and Italy, and he wanted actually to get a little pay out of it, because I understand, you know, his patrons, his corporate patrons, you know, who are in this medical lab business, hey, they're making out like fat rats right now. So they privatized it. Okay, I'm over that. Let's just get the test done. We need to test every single American. Unfortunately, we're running out of time, which is why today they've even, CDC, the administration, states that are hardest hit, Washington State and California and New York, have said, we don't have enough resources. So we're only going to test people who are showing actual symptoms of the disease. It'd be better to test everyone. That's what Wuhan, China did. They went door to door. They tested every citizen in their province. And they knew who had the disease. And they quarantined them. And in 3 months' time, they're over this pandemic. Our response wasn't that. But that's okay. We're here today. We know what to do. We're wiser. We're smarter. And we have to depend on the scientists. So, if you have a fever, a cough, or shortness of breath, you could be having symptoms. They will express themselves in 2 to 14 days. Now look, if you develop emergency warning signs for COVID, get a medical attention immediately. That's if you can't breathe. If you have ongoing persistent pain and pressure in your chest, if there's confusion and inability to arouse yourself, the lethargy sits in. It could be problems with oxygen going to your brain. If your lips turn blue or your face turns blue, get to the emergency room. Otherwise, ride it out. Ride it out. Because if you're healthy, you can, as most of the scientists are saying, 80 to 90% of the people who get COVID-19, their immune systems will battle it, okay? And there is some good news too. I guess I heard this in New York this morning, and we heard at the press conference yesterday with the coronavirus task force that there's a potential for a medication to help with the most severe symptoms of this. Wow, won't that be fabulous? It isn't here today. We have to do clinical trials. Science has to lead the way, not a hunch, not I heard this works good, not, oh, a hope and a prayer. No, science. So in New York City, they're taking that suggestion from the task force in DC, and they've ordered the 2 drugs, the erythromycin and the chloroquine, and they are going to run clinical trials with a large sample to see if it works. That's science leading the way, not a hope and a prayer. I'm not saying there isn't room for hope and prayer. Don't get me wrong. I take every day a personal responsibility to keep my spirit lifted. I do pray. I do meditate. I do connect to people for love and support. And we have to do these things. I help to allay my own fears. I think that's important. But that doesn't mean I am blind to the severity of the situation we're in. So science is going to lead the way. All right? Now look, if you have extreme symptoms, like what was said, get to the emergency room, right? Now, what is the other thing I wanted to say? This is very important. Let's go back up to the top of the website. Somehow this is not cooperating with me, right? So let's just see if my scroll. Here we go. All right. And you can see on this website, they give you a coronavirus self-checker. So you could, use this tool that's available to you and, see if you think that you're in harm's way, right? And look, if you're an older adult, if you have underlying medical conditions, this could be serious for you. You may not have the kind of immune system or lung capacity to handle this. If you're an older adult, I believe they define that as 65 years or older. If you're a person with an underlying medical condition like heart disease, diabetes, lung disease, you know how many people like that have it? Especially, let me just say this, people in the African American community. High incidences of heart disease, diabetes. This is serious. Get the facts. Social distance. Social distance. If you're pregnant, you have HIV, you have asthma, all these sort of things, you're at higher risk. It means that you have to follow these guidelines. Distance yourself from people. Wash your hands. I mean, all the time. You got to wash for 20 seconds or more, right? You got to monitor your health. Take your temperature. See if you have a fever. If you get that cough, to open up a book, write a piece of paper, take a piece of paper and a pen. Start tracking your symptoms. At this time, my temperature was this. At this time, my temperature was that. At this time, my cough started. At this time, I started feeling tightness in my chest. And then when you start to feel like it's an emergency, get to the ER. And you can call your doctor in the interim. And there's tons of places you can call if you need to get some consultation and advice. Because they don't want everybody running to the ER either if you just have a cough, right? And again, I want to stress this over and over again. 80 to 90% of people are going to be fine. You'll have some symptoms. You may have a slight fever, you might have a fever, you might cough, you might, have diarrhea, you might have shortness of breath, these sort of things for a few days, and then it'll get better for the overwhelming majority of people. And then for these other people who are at risk, it won't go that way. And we need to preserve hospital beds for them. We don't have enough hospital beds. In New York City, they're converting the Jacob Javits Center into a hospital. Other kinds of places all around the country where they're hardest hit, Washington State, California, they're building hospitals on soccer stadiums, in ballparks. We don't have the capacity to deal with the surge that could come. Not enough staff, not enough doctors, not enough beds, ventilators, masks, unless we come together and we act smartly in this time of crisis. Yes, we're all scared. Some people have lived through the HIV virus epidemic of the 80s. Some are much older in our communities who've lived through the measles outbreaks. West Nile virus. I remember 2 summers ago, oh my God, I was so afraid to be bit by a mosquito. These things happen. We're all connected. Yes, that started out in the Caribbean, and it made its way to Florida, and it made its way up to New Jersey. This happened in China. It made its way to America. It made its way to Europe. It made its way to Canada. It made its way to the Southern Hemisphere, to Africa, to South America. It is everywhere, and we all have to come together. Do the right things for one another in this time of crisis. Look out for the older people in our lives. Those spring breakers in Florida for the last 2 weeks, and the idiotic things they would say when the cameras and microphones were in their faces about how we're entitled to spring break, we're here to have fun. And then they go home to their parents and their grandparents, and God knows what they're bringing to them, because their ignorance and their arrogance prevented them from doing the right thing. We're all in this together. That's the message. And we have to prevent the calamity from becoming a catastrophe in America. You are responsible for that. You are responsible for that. I am responsible for that. Have you been hearing this? We're all responsible for this. Schools have shut down, businesses have shut down, but what I heard was that essential services are going to be A-okay. Don't worry, there's going to be food. There's going to be toilet paper. You don't have to go out and buy like crazy. All right? The best way to prevent this illness is to avoid being exposed to the virus. The viruses start to spread mainly from person to person, between people who are in close contact with one another, within 6 feet. And it also is transmitted through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths and noses of people who are nearby and possibly inhaled. So what do you have to do? Wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. And avoid touching eyes, nose, mouth with unwashed hands. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. Is it in your community? Is it in your community? Is it in my community? It's in our country. It's on our planet. One earth, one people. So listen, try to protect other people too. Let's not be selfish. Stay at home if you're sick, unless you need emergency care. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw the unused tissues in the trash, and immediately wash your hands with my sanitizer, because I was sneezing. And you want to wash your hands, and you want to make sure you get all that sanitizer on your hands until your hands feel dry. And if you're sick, wear a face mask. You should wear a face mask when you're around other people. If it causes you, then you should do your best to cover all your coughs. Listen, if you're not sick, you don't need to wear a face mask unless you're caring for someone who's sick. Just remember that. You have to clean and save the mask for the healthcare workers. Doctors and nurses are getting sick. We're starting to import people from other states that have less of a viral outbreak because we need the help. Save the mask for them. I hear Hanes Clothing Factory that makes your socks and your underwear, they're retooling their companies. They're going to manufacture masks. God bless them. I hear we're procuring more ventilators. God bless them. I hear they're converting factories to make more ventilators. God bless them. That's the response we need at this time. Everybody pulling in together. And don't forget, you have to clean and disinfect frequently touched surfaces. Includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks. Very important to disinfect. So go onto this website. It's got plenty of good information, right? And as I said, we're all in this together. Let science lead the way. I know everybody's trying to encourage, hope. And lots of people are praying, and we need that. But we need factual information. Every media organization is responsible for this. And we need to be calm, manage your stress, manage the anxiety, whatever it takes. You can now have therapy online. You should be talking to your friends, connecting with the people you love. Read a good book. Watch a good movie. Get out and exercise. But that doesn't mean playing basketball or soccer or multi-families hanging out and playing. Take a walk. Take a stroll. Keep the social distancing. It is going to save many, many lives. It'll save your life. It'll save the lives of others. Thanks for tuning in for Dr. Milton's Social Work Show. I ask you to keep the faith. Together we're going to get through this. Peace.